Hello and welcome. This is Dr. Barbara Miller, NCLEX review. My review will be a weekly upload. Every Wednesday you will see something that will improve your knowledge and preparation for the NCLEX or your State Board of Nursing review, whether it's an RN, registered nurse, or you're going for your licensed practical nurse. Okay? You will see something. I will have an upload every Wednesday for 6 weeks. Then the same will recycle if you still need to learn more. I'm sure lots of students out there, they graduated, but they're still struggling to be successful on the state board. So every Wednesday, starting on the 6th, you will have a weekly upload, and we're going to be starting on medical surgical nursing. Then we're going to go to maternity nursing, pediatric nursing, mental health. We're going to go over some pharmacology, like drugs that you do need to know to be successful on the State Board of Nursing. We're also going to be doing a few leadership, okay? As you know, the undergraduate, you should have an idea about some sort of leadership skills. So we're going to be going over all that. Okay? So today, our first topic would be the endocrine system. Lots of students, they reach out and they inform me that they struggle on the endocrine system. The endocrine system, you do have hormones that hypersecretes, and you have hormones that hyposecretes, which could cause an imbalance in our bodies. So let's start with diabetes. You should know something about diabetes for the NCLEX. You do have 3 types of diabetes. It could be also a 4th type. So let's go over diabetes. Diabetes type 1, also known as insulin dependent, meaning that the pancreas does not make any insulin at all. Therefore, that patient must administer insulin. You also have type 2 diabetes, which also known as insulin resistance. The pancreas makes some insulin, but it resists. Then you have another type of diabetes, also known as gestational diabetes, that comes along with pregnancy around the 28 weeks of gestation. And diabetes could also cause from certain medications. For example, total parental nutrition can cause a patient to go into full-blown diabetic episode without any history of diabetes. Okay? So, for example, if the board asks you about diabetic ketoacidosis, you know that that comes with type 1 diabetes. Diabetic ketoacidosis means that the glucose is going to increase to a dangerous level. And what would you do for that? You would give IV regular insulin. That would be the only time you would administer IV regular insulin. Then you have your type 2. How would you treat type 2 diabetes? Diet, exercise. Okay? You want to try meal prep. You want to cut down on your carbohydrates, saturated fatty acid, those things, and exercise. You want to instruct your patient to walk. Walking is paramount. That helps to decrease your body mass index. And sometimes with type 2 diabetes, they may resort to insulin if the hypoglycemic agent does not work. For example, patient may be placed on glucophage, and that doesn't work. The hemoglobin A1C still remains above 7. Okay? So those things, when you monitor your patients and the patient is not being controlled, the doctor may resort to insulin, more so if that patient has renal disease. For example, that patient may have renal transplantation. And if the patient is getting like cortisone, glucocortisone, prednisone, you want to monitor the glucose because it also can cause an increase in the patient's glucose. So remember, type 1 diabetes, insulin dependent. Type 2 diabetes, insulin resistant. Gestational diabetes occurs around the 28 weeks of gestation. Okay? And those patients need to be monitored closely after the delivery. Okay? The baby will have some difficulties with hypoglycemia. So they would normally give that baby glucagon. So I would like for you to go over your insulin. Insulin is very, very important for you to review for your state board. And I will also upload an excerpt, okay, for you to know the peak, the onset, the peak, the duration, okay, of insulin. Those type of questions you'll encounter on the State Board of Nursing. So what are some rules for diabetic patients? You want to instruct your patient, okay, for those who gets insulin, that they need to rotate the site. Those type of questions you will encounter, okay? You're not, or against the rules, for lack of a better communication, or lack of a better word, rather, excuse me, that you should not give the insulin at the same spot to prevent something called lipoatrophy. Okay? Loss of subcutaneous fat. If you keep doing it over and over, the patient will develop hypertrophy or lipoatrophy. Fatty mass at the injection site. Also, you will hear patients state that their glucose levels go higher at night, maybe between 5 a.m. and 8 a.m. So you may want to say that is called the dawn phenomenon. So two terminology that you must instruct your patient about: dawn phenomenon and also the Smoothy phenomenon. The dawn phenomenon, what you need to do to solve that issue is to increase the insulin, okay? Because what happens, the patient will have a rebound, okay? So you want to adjust the insulin. And the Smoothy phenomenon, you want to lessen the insulin and you want to give more snacks, more bedtime snacks. You ought to know the different types of insulin. Rapid acting insulin should only be given if the food is available and patient is ready to eat. Why? Because you could give that insulin and the glucose drop to a very dangerous level, and that could cause major complications for your patient. So you want to give it when the tray is on the unit or the patient has some type of food at the bedside or in harm's reach. So go over your insulin, and sometimes it's good to do like a surface learn, okay? You want to learn the types of insulin, whether it's a rapid acting insulin, whether it's a short acting, whether it's an intermediate or NPH or a long acting insulin, so try to memorize those that could, work best for you on the State Board of Nursing. Okay, so sometimes they may ask you, how would you draw your insulin? You want to draw up your regular insulin and pH together, cloudy. You want to inject air into the NPH. Clear, you want to inject air into the regular. Clear, you want to draw up the clear first, then the cloudy second. Nowadays, they do have insulin pen, okay? And it's more adequate or more precise when you're pulling up your insulin to ensure that they don't overdose or underdose that patient. Know your clinical manifestations of hypoglycemia. Okay? Patient has a drop in the glucose levels. You want to give something sweet, like a glass of orange juice. Okay? A piece of hard candy. But don't sit there and have the patient go into major health issues with a very low glucose. Know your clinical manifestations of hyperglycemia. Patient needs to go to the hospital if the glucose is over, okay? It could be 200 and it's not being controlled at home. DKA, you will see that in type 1 diabetes, Patient needs to bring the glucose down, okay? Urine ketone testing should be done also when the patient is in hyperglycemia, okay, situation. So regular insulin will be administered for patients who are in diabetic ketoacidosis. Another type of diabetes that you may encounter on the state board, and this occurs more with the elderly. As we get older, sometimes we forget to drink. Okay, patient becomes dehydrated, hyperosmolar, hyperglycemic, non-ketotic syndrome, HHNS. The potassium is low due to diuresis. Fluid are the most important intervention. So if you see these type of questions, you're not going to resort to say administer a rapid acting insulin such as regular insulin. That comes in the last resort. For example, they may hydrate that patient and the glucose is still rising. Then they may resort to a rapid acting insulin. However, HHNS, the goal to treat that is to hydrate the patient. Know your hemoglobin A1C, okay? Because that will ascertain whether the patient is following their daily regimen. The doctor is looking for an ideal hemoglobin A1C between 6, low 7, or ideal is below 6 or below 7. What they're saying between 4% to 6% is good. 8% or greater indicates a very low control. So you want to instruct your patient to follow diabetic regimen, exercise, take their hypoglycemic agent as prescribed, or take their insulin as prescribed, and follow their dietary regimens. Remember, blood sugar, hot and dry. When the patient say, "Nurse, I'm feeling so warm or hot," that means hyperglycemia. If the patient say, "I'm cold and clammy," you need a piece of hard candy, hypoglycemia. Let's repeat. Diabetes, the clinical manifestations of hyperglycemia, which is diabetic ketoacidosis, is that of the patient experiencing hot, very hot and dry skin, and in contrast, cold and clammy reflects hypoglycemia. Another type of issues or conditions with the endocrine system is that of thyroid. Okay? you will hear the patient feeling a certain way, whether they have heart racing, their pulse is beating out of proportion, normal pulse rate 60 to 100 beats per minute. They may have either hyperthyroidism or hypothyroidism. What is that? What is hyperthyroidism? Over secretions of the thyroid glands. And what is hypothyroidism? Under secretions of the thyroid gland. Now, you want to look at your patient. What are some clinical manifestations of hyperthyroidism? Look at the patient, you see the eyeballs. Because of the hypersecretion of the thyroid, the patient will have big bulging eyes, also known as exophthalmos. You will see the patient has a bulge at the neck area where you could locate the thyroid gland, which is also known as a goiter. So overall, hyperthyroidism, also known as Graves' disease. Hyperactivity of the thyroid gland. And how do you treat that? There are many ways to treat hyperthyroidism. You could also treat hyperthyroidism with prothyroxine. That's one medication given. You could also treat with radioactive iodine. That's one dose. You could also treat with beta blockers. Okay? However, if they treat with radioactive iodine, that could take it down now to hypothyroidism. Patient would need to be on a lifetime medication such as Synthroid or levothyroxine. The boards may ask you, when would be the right time to take a levothyroxine or Synthroid? Early morning, the first thing in the morning on an empty stomach before breakfast time. So go over hypo and hyperthyroidism, which are two major complications of the thyroid gland. Okay? Patient will develop complications such as a thyroid storm. What is that? When they fail to take their prescribed medications or some stressful situation could cause that patient to go into a thyroid storm. So thyroid storm and hyperparathyroidism goes hand in hand. And hypothyroidism, not parathyroidism, that's another part we'll discuss. Hypothyroidism, you get something called the myxedema coma, which is also a life-threatening situation. Why? Because of the decreased production of the thyroid hormone. Patient could go into coma. Patient will have difficulty breathing. Okay? So on your NCLEX, think hypo metabolic state, cardiovascular. What comes with hypothyroidism? Bradycardia. Patient is fatigued. The patient is listless. Patient has hypotension. Patient is constipated. So everything goes down with hypothyroidism. Their pulse rate, bradycardia. And in contrast, with hyperthyroidism, everything goes up. Okay? Just remember that. Hyperthyroidism, your T4 and your T3 will goes up. And your thyroid stimulating hormone will go down. T3, T4 goes up, and your TSH goes down. And in contrast, hypothyroidism, your T3 and your T4 goes down, and your thyroid stimulating hormone goes up. Those are the things that you need to journal your notes. When you journal your notes, you tend to remember more readily. So go over your hyperthyroidism and you will see. You look at the neck area. If you were to ask, what is a goiter? The hormone, the thyroid gland gets larger. And you will see a bulging at the neck. Don't forget, NCLEX, you got to know your T3 and your T4 will go up, and your thyroid stimulating hormones will go down. And what I'm saying, hyperthyroidism. You got to know those for the NCLEX. And what's the complication for hyperthyroidism? You get something called thyroid storm or thyrotoxicosis. Those could be life-threatening situations. In contrast, hypothyroidism, you get something called myxedema coma. The boards will ask you, well, you're looking at the lab, okay? What are you looking at? You're going to look for T3 and T4 is going to go down. And your thyroid stimulating hormone will go up if we're talking about hypothyroidism. Hypothyroidism, you got to take Synthroid. Also, your patient is on Synthroid. What do you need to check? The liver. It will change the liver enzyme. So patient who takes levothyroxine, they should monitor their liver enzymes, okay, to see if there's any changes. Another set of endocrine disorders you may encounter on the State Board of Nursing is diabetes insipidus versus syndrome of inappropriate antidiuretic hormones. Okay? What is that? What are those? Diabetes insipidus is hyposecretion or failure to report in the antidiuretic hormone. Okay? Or to respond to the antidiuretic hormone. And what you need to know, diabetes insipidus, the patient will have large amount of urine on a daily basis. These patients will have over 4,000 milliliters of urine per day. So as a nurse, you got to observe the urinary output. Know what medication is given for patient with diabetes insipidus. Desmopressin and vasopressin. Okay? What type of fluid therapeutic management you want to give, like D5W, okay, for fluid replacement. Because those patients, they will lose lots of fluid on a daily basis. The other type of condition, syndrome of inappropriate antidiuretic hormone. And what is that? Oversecretion. Oversecretion of the gland. Okay? And here the patient, what caused it? It could be a tumor, it could be infection, it could be medication. So the NCLEX, you want to assess fluid volume excess or retention. Okay? You will auscultate the lungs for crackles. If you're hearing crackles on the lungs, those are called adventitious sounds. Adventitious sounds, they are abnormal sounds. Okay? So you want to monitor the patient's EKG, because syndrome of inappropriate antidiuretic hormone will also cause some dysrhythmias. How would you treat that? Diuretics. Diuretics such as furosemide. Furosemide, also known as Lasix. That's a high ceiling. So you want to check that. You want to check the patient for high specific gravity. They could go into heart failure. So also, it can also affect the renal system. So you want to weigh the patient, daily weight, the same time. Okay, the same clothing to ensure consistency. And remember, SIADH, those secretes from the posterior pituitary gland. And they will ask you on the boards. SIADH, they have hyponatremia. So with patient who is experiencing hypersecretion, okay, they will have low sodium, hyponatremia, and in contrast, diabetic or diabetes insipidus will hold on to their sodium, so they will have hypernatremia. Those are the things you need to know for your boards. Okay, diabetes insipidus, hypernatremia, syndrome of inappropriate antidiuretic hormones will have hyponatremia. Another condition you may encounter, hypomagnesemia and hypermagnesemia. Remember, your magnesium, it controls the muscles. So if it hyposecretes, it will affect the cardiovascular system. It can affect the heart. Okay, so hypomagnesemia, okay, patient will start having tremors, tetany, seizures. It also can cause dysrhythmias. What are some dysrhythmias? Like a ventricular tachycardia, okay? Those could be a life-threatening situation. Patient may end up being depressed. Those are some clinical manifestations of hypomagnesemia. Okay? Low magnesium may lead to digoxin toxicity. What's the use for digoxin? It strengthens myocardial contractility of the heart. So when you're giving digoxin, you gotta monitor the pulse. If the pulse is below 60, you wanna hold. You would not administer that. But I'm just saying, patient with low magnesium, they will end up with the digoxin toxicity when they're getting digoxin to strengthen their myocardial contractility of the heart. And in contrast, high magnesium levels could also lead to depression, central nervous system disorders, hypotension, facial flushing, muscle weakness, absence of the deep tendon reflexes, shallow respiration. Okay? Anything with a respiratory status can be a life-threatening situation. No other system, okay, take the place of our breathing. Breathing is number one. Another disorder is that of Addison disease, hyposecretion of the adrenal cortex, and Cushing disease, hypersecretion of the glucocorticoids. If you look at patient with Addison hyposecretion, they end up with a decreased levels of glucocorticoids. The NCLEX will point out assessment. You want to assess patients with Addison for hyponatremia. Hyponatremia, it's going down. Hyperkalemia, it's going up. So Addison disease, you want to look at the labs for hyponatremia, and also look for high potassium hyperkalemia. Hypoglycemia also. So you want to administer replacement of the adrenal gland. It's going to be lifelong, because failure to do so, patient could go into a crisis called Addisonian crisis. And that could be life-threatening. So I'm going to upload these excerpts so you go over these little gaps in the knowledge to be successful on your NCLEX. Cushing's disease, and what are the cause of Cushing disease? It could be the patient spent all these years on corticosteroids. Okay? Corticosteroids is a major contributor to Cushing's. The NCLEX will say Cushing's, they will have hypernatremia. So it's the opposite. And also hypokalemia. The potassium is going to be down. They will also suffer from hyperglycemia. If you look at patients with Cushing, they have round moon face, they have a pendiculous abdomen, their lower extremities very small, very thin, and look fragile, and their stomach is very pendiculous. They do have something called a buffalo hump. So you want to look at that. These patients also end up with cardiovascular features. So you want to provide proper skin care to these patients. And they may end up with adrenalectomy if there's a tumor on the adrenal gland. Okay? So, Cushing disease, they're a very, very sick patient. They will have moon face, and I'm repeating, buffalo hump, muscle wasting, edema, and they will start displaying clinical manifestations such as congestive heart failure or just heart failure. The other type of endocrine system that I was told appear on the NCLEX is something called pheochromocytoma. Whenever you see this, it's a tumor of the adrenal medulla or the adrenal glands, which cause an hypersecretion of epinephrine and norepinephrine. What are some signs or clinical manifestations of pheochromocytoma? Patient will have persistent headaches, increase in heart rate. Remember, the heart rate goes from 60 to 100. So, patient with pheochromocytoma, the heart rate may be over 100. That is going into tachycardia. They also will have high levels of glucose, hyperglycemia. Remember, patient has a high level of glucose, their skin is going to be hot. Low levels of glucose is cold and clammy. So how do you manage hypopheochromocytoma? Avoid stress. As you all know, stress is a major contributor to a whole host of diseases and conditions. And this is one, pheochromocytoma. Avoid stressful situations. Okay? Avoid stimulating foods. What are some foods that stimulates us? Caffeine. Okay? So if your patient takes caffeinated, whether it's tea, coffee, chocolate, you want to advise them to do decaf. Avoid foods that high in tyramine. Tyramine is like old age cheese, foods such as salami, foods such as hot dogs, aged cheese, wine, all those has tyramine. And patients with pheochromocytoma, you want to avoid palpation. Palpating the abdomen, it could be an aneurysm, so you want to avoid palpating the abdomen. Treatment for pheochromocytoma is that of surgical to remove the tumor. So these are some endocrine conditions that you may encounter on your state board of nursing. Hope this session will help you to improve your endocrine system knowledge. Thank you, and see you on the next video. The next video will be on the respiratory system, then the cardiovascular system. As mentioned before, it's going to be weekly sessions that comes out every Wednesday. Thank you.